Hi everybody. Okay, so today is my day 2 post-op and I'm feeling good. I still can't shower. They haven't changed my bandages yet. I'm going to show you all that in a second. But today's day 2, no shower. Can't wash my hair. Maybe my kids will help me later. And I can only wear t-shirt and leggings. But I am able to raise my arms today. So I have to be very careful, but I can raise my arms up. Yesterday I could not, because these muscles right here, your pec muscles, are really, really sore. So I just have to be careful. Like, my mom helped hang up clothes, but other than that, I can reach stuff. So I'm going to show you today what most people don't show you. It's kind of like having kids, and people don't tell you the bad part of having kids. Well, I'm going to tell you kind of the bad part of having this done. The uncomfortable part. It's not terrible. It's just uncomfortable, and it's just awkward having these drains hanging from you all the time or whatever. So typically they stay in 3 to 5 days. They can be more if you're draining more. Hopefully mine come out on Monday. We'll see. Fingers crossed. So anyway, here's what they look like. So I'm still swelling quite a bit. So you can see my belly. It looks very much like I'm a little pregnant lady, and I'm not. But it's just typical. My hands and feet are swelling because you have a lot of fluid and a lot that has gone on. So it's just a lot of stuff trying to get out. So here's my cute little tube top that I have. Don't be jealous. John wants me to wear it afterwards. So here are my drains, and I just emptied these relatively not long ago. So you can see this is kind of gross. So if you don't like it, just skip past it. It's kind of clear liquid now. Today, you can't really tell, but up against my skin, it's not really, really red. It's not a lot of bloody. So the first day you come home, it's really like bright red blood, like you just stuck yourself with a pin and bled into it. Now, it's just a little bit more clear stuff. So this one is my right side, and they label it 1 and 2. So this is my right. Well, sorry, it's my left. You're looking at my right, it's my left. And then this is my right. So I emptied these about an hour and a half ago, and you can see there's not a lot in them, and there's not a lot of fluid down in here, which is awesome. That means that I'm draining really well, and hopefully they'll take them out. So I'm not going to show you like my parts, but I'm going to just, kind of show you some stuff. So you won't have this. This is a little cyst that I had or something. They don't know what it was, but they had to take it out. It was a little knot, and they don't know if it was related to my implants or not, but they took it out. And then here is, under here is where I'm bandaged. You can see I have tape right here, and then my drain goes in here, and it's sewed in. So hopefully when they take that out, well, Monday they'll just cut that out. So it comes from here on both sides. Nothing crazy. And then the top is just like normal. I'm not going to show you anything, but it's just, nothing's cut on up here. It's just normal boobies. So that's all it is to your drain tubes. They're just, in the side. And then, of course, there's little bitty cuts. He just marked little bitty places where they pull everything out. And so I'm sore to the touch. Like, this hurts to touch, but it's more like a muscle thing. It's not so much like, I don't know. It's just almost like you did a million push-ups, like I said the other day. And the incisions are tender to the touch. Like, to touch under here where they cut is tender, especially if I stand up too long. But for the most part, it's not painful. It's not as bad as having them in. I will say that. So if you obviously watching this, you've had them in, or you know someone who's had them in, that's painful. It feels like you have an elephant sitting on your chest. It's obnoxious. But this is not so bad. This is just irritating because, who wants to go out and see your little drain tubes walking around? So it's kind of weird to go anywhere. That's why I have it. So you have to clean these. So you have to, let me show you this again real quick. If you're thinking about having this done, this is one of the things that's not so much fun. So you kind of start as high as you can, and you hold, and they call it milking it or stripping it, and you just kind of push. You're basically pushing all of the liquid down into that little bag, and then you have to measure it, and then you have to record it, because they want to know how much you're outputting. If you're putting out too much, then obviously that's a problem. If you're not putting out enough, then that's okay, because that means your body is absorbing. That could be why I'm swelling a lot, because eventually your body will absorb that fluid, I should call it, not liquid, fluid, and then it just goes down in your bag. And so I don't really have a ton right now, which is super awesome. And so yeah, that's how you strip your bag. There can be clots in it and things like that the first day, so that's not, it's not a whole lot of fun. If you get grossed out by it, have somebody else do it. But you just want to be careful pulling right here, because it is sewed in, so you don't want to pull that stitch out. Let's see. The other thing is, sometimes the medicine they can put you on can make you not go to the bathroom, so you have to figure out how to do that. I've been taking probiotics, and I'm going to drink some tea tonight to see if that'll help. But nothing awful. So today is day 2 for me, and I've only had, yesterday, I only had 2 pain pills. so I did like half and half, and then one at bedtime. And then today I've only had Tylenol, just 2 Tylenol, and that's it. And I'm really not miserable. I need to go lay down just to kind of get off my feet, but I was able to work yesterday. I was able to work today, and I work at home from the computer, so it wasn't miserably uncomfortable. And so I will tell you that my brain fog is gone. My backache is still gone, which is wonderful. Like I said, I've waken up for like the last 2 years with a backache right here in the lower part of my back every single day. There's nothing I could do about it. My chiropractor did help, like I said on my last video, but it would always come right back. So here's to hoping that it stays gone. I've noticed that even my arms and stuff don't feel so swollen. So yes, my belly is swollen, but like before my surgery, everything felt really puffy and just really swollen, like my cells were swollen, and I don't feel that way anymore. My belly could just be because I have a lot of gut issues, and typically when you have breast implant illness, you do have a lot of gut issues amongst all the other things that you have. Your gut is the one that's affected because it is the biggest brain in your body besides your brain. And so it gets affected the most. And so I'm really trying to eat very clean and take my probiotics and not just go crazy because I'm post-op. I want to try to heal my body as fast as I can. And the quicker I can detox, the quicker my body can heal, and all of those symptoms will go away. So my next one is I have a rash on the back of my legs, kind of like when you eat gluten. If you eat gluten and you're intolerant to it, you can have like this ketosis pilaris, if you've ever seen anyone with bumps on the back of their arms and legs. So I'm kind of hoping some of that goes away too with all of this being gone. But I'm pretty happy right now. My breathing is still good. My throat doesn't feel swollen. I was having problems with my thyroid, and my throat felt swollen and puffy all the time, and I was having a hard time swallowing. My throat is still a little sore because they had a tube down my throat, but other than that, it feels fine. Let's see. A lot of other symptoms won't go away immediately, but those are the few things that have gone away immediately, which is really, really nice. So anyway, those are the goods and not so goods, I guess, of the surgery is, just your drain tubes and everything being really uncomfortable. Once I go on Monday, they should take all this off, hopefully, like I said, and then they'll put me in just a regular sports bra, and I'll continue to heal. I won't be able to do any lifting or anything like that. Like, I can't pick my little doggies up because they're 10 pounds. So you can't lift over 10 pounds for a couple weeks until they give you the clear. And then after that, you can slowly start doing like walking, and then you can start doing weightlifting and things like that again. So it'll be a couple weeks before I can do that. So mega nutrition right now. Anyway, that's it today. That's all I have on my day 2, and I'm feeling good. So if you're thinking of doing it, I would recommend it, truly. I feel great. I have more energy now than I did 3 days ago, which is insane. But like, I was drinking 2 cups of coffee, and then sometimes my Energized drink, which is the energy drink, it's a plant-based energy drink. I was drinking 2 cups of coffee in the morning and that in the afternoon, and still was just wiped out. And I'm not really that tired. I have a lot of good energy, which I've heard, which is awesome, because then that means hopefully my fatigue is gone, which is why I haven't laid down very much, because I just don't feel very sleepy. So anyway, I know I need to lay down though. I'm going to. Anyway, if you have any questions, you can post them. I'm not overly educated about this, but I do know. I was explaining in my last video. Let me explain this really quickly. And then if you have any questions, if I can't answer it, then I'll of course point you to the website that I have been going on. So when you have your, when they take your implants out, they took my implants out, and then they took my capsules out, which is like the thin eggshell layer that your body creates. So when they take that out, and then they take your capsule out, which you should have a total capsulectomy. If they don't take your capsule out, then your body still attacks that, because it's basically a thin layer that's between your body and where your implant was. And so then your muscle doesn't adhere correctly because there's this thin layer of something. So they should do a total capsulectomy. Whether they do an en bloc, that's up to your surgeon, I guess. I did not have that, and you will hear that if you're looking to have this done. So once they take your implant out, and then they take your capsule out, you want your muscle to adhere back to your body. And so that's what these drains are for, is that empty space. It will fill with fluid. And so in order for that not to happen, they give you the drains. So that's at least how my doctor explained it to me. It makes total sense. And then once your muscle adheres, then of course you're healed, and then your body will continue to detox its cells, because if you have breast implant illness, you have toxicity everywhere somehow. And so it's going to have to detox. It's not just in this local area. It's going to be your whole body. So treat your body well, take care of it. You've done the right thing by taking them out, and so now just continue to heal it. So I'll talk to y'all later.